Welcome. My name is Nisha Sajnani, and I am the founder and co-director of Arts and Health at NYU. And I see that we have our slide up to welcome all of you here. And we're just going to take that down in a minute so that we can see one another. Hold on 1 minute. All right, welcome. So as I was mentioning, my name is Nisha Sajnani. I'm the founder of and co-director of Arts and Health at NYU and chair of our Creative Arts Therapies Consortium. And it is my great pleasure to co-host the first in a series of conversations on advancing research on the arts and health as part of the Arts and Health at NYU and Healing Arts New York, which some of you have been following, and for others, the website will be available in the chat in a moment. So today we will hear from a selection of researchers who have recently published their work in a special issue of Frontiers on the psychological and physiological benefits of the arts. And I've had the pleasure of co-editing this special issue together with co-chairs for this conversation, Vicky Karku and Jen Drake, who I will introduce in just a moment. And we will put that link to the special issue, that research topic, in the chat. If it's not there already, it'll be there in a minute. So we seek to grow our community in this area and our collective capacities for designing, evaluating, and communicating the impact of the arts on our physical, mental, and social health and well-being. We know that arts-based practices offer us many models of care and collaboration in a time when our awareness of our interdependence is so necessary. So with this in mind, some of you have already started to do this, but I will welcome you to introduce yourself in the chat, where you're joining us from, and to share something about how you connect to this conversation. Perhaps you're an arts-based practitioner interested in the impact of your work. Perhaps you're an arts therapist, a healthcare provider or researcher who uses the arts or studies the impact of the arts. Perhaps you're a policy advocate or a publisher. Speaking of whom, I am so pleased to co-host this session today, this conversation with Christopher Bailey, lead for the arts and health at the World Health Organization, and Dr. Fred Fenter, chief executive editor for Frontiers. I'm going to pass this on now to Christopher Bailey. Christopher and Fred, welcome. And I'll start with you, Christopher.
Oh, thanks a lot, Nisha. It's a pleasure to be here. As Nisha said, I'm the Arts and Health lead of the World Health Organization. And our program basically falls into three categories. We're looking at the research agenda, best exemplified by our 2019 report that came out of our Copenhagen office on the evidence base for the health benefits of the arts. If you haven't seen it, I highly recommend it. And then the second category of work that we do is working with communities on arts-based interventions in WHO priority areas. And then the third is working with the global media, and that could be film companies, orchestras, you name it. Perhaps the most gaudy example was our collaboration with Lady Gaga at the beginning of the pandemic, which was important not just for the money that it raised at a crucial time in the pandemic, but more importantly, we were able to reach every part of the world with key health messages of washing our hands, keeping our distance, staying at home, honoring the frontline workers, and most importantly, this concept of solidarity, which is so vital during a health crisis, but particularly a disease like COVID, which as long as some people are vulnerable, all of us remain vulnerable. So that was a hugely important event at the beginning of this journey that we're still on, unfortunately. Now, in terms of my own background, years ago, I was an actor, writer, playwright, and during my close to 20 years at the World Health Organization, I have on evenings and weekends helped run a theater company, and in the course of my work, often in villages and clinics in Africa and other low resource settings, I would include forum theater techniques and other artistic levers to engage people and give them a sense of ownership over the process. And these two worlds in my life kind of worked in parallel until Dr. Tedros came on board and put out his famous call for crazy ideas. And my crazy idea was to start an arts and health program. But I've always felt in this liminal space as almost a translator between the creatives and the scientists. And with the scientists, sometimes, especially in the beginning, it was hard to get people to understand what we were doing and why. It would often be dismissed as recreational. And I would say, listen to that word, recreational. It's about recreating ourselves. That's healing. And to the artists, they would say, well, why do I need to measure anything? I know when something is good. I can hear the applause. I can feel the reaction. I don't need a measure to tell me. And I say, that's absolutely true. But in an environment where arts budgets around the world are under pressure, under threat, or have been cut, to make the case for investment, we have to show something more than the arts being a nice to have. Why is it essential? Can we actually establish that? This is the year of the creative economy, and there have been a number of really interesting studies, some of them from the World Bank, about how sustainable development is only achievable if there's a thriving arts section. We can make that argument. But from a WHO perspective, we would like to make the argument that an investment in health, in the arts, in a community is an investment in the health. And being able to measure that is essential, because the road to public health is littered with the wreckage of tiny pilots. To be able to show what is the best practice, to be able to show evidence of why that worked, how it worked, and what is replicable and what is scalable, then we can bring, as WHO, the ministers of health, and with our partnership with UNESCO, the ministers of culture, to see if we can create policy for national investment in the arts. And that's already beginning to happen in this virtuous cycle. So I'm really looking forward to today's event so I can learn about some of the research going on by this august group of people. And I am going to stop talking because I'm here to listen. And I am greatly looking forward to what is about to transpire. Thank you.
Thank you so much, Christopher. And thank you, Dr. Fred Fenter, for joining us from Frontiers. I'll pass this over to you.
Thank you, Nisha. Thank you very much. And before I get going, I just want to say my name is Fred Fenter, and I am the Chief Executive Editor of Frontiers. But as probably some of you can see behind me, I'm also an amateur musician. And I have to say that the arts, particular music, for me is my personal therapy. So I think a lot of us understand viscerally the importance of having some kind of artistic activity in life, and the role that plays in just a daily well-being. So I'm very happy to be here. I'm going to share my screen with some slides. I think it's this one. Share, and then voila. Okay, I think that should be good, right?
Yes.
Okay. Okay, terrific. Yeah. So again, thank you very much for the invitation. It's a great pleasure to be here to celebrate this really incredible success of this research topic project published in Frontiers in Psychology on the psychological and physiological benefits of the arts. Before I get going, I'd just like to say a few words about Frontiers for those of you who don't know us. Frontiers is an open access publisher whose mission is to make a critically important improvement in how society accesses, processes, and benefits from scientific knowledge. Each and every one of the hundreds of thousands of articles that we have published can be consulted, downloaded, ingested into databases by everyone. And I think this has been our mission, our philosophy from the day we founded Frontiers about 15 years ago. We currently publish 129 journals, which covers 1,000 distinct academic disciplines. And so we have 1,000 editorial boards with an editor-in-chief and editorial board members, et cetera. What this means is that, let me just say, the program has been growing year on year. We've really benefited from we really embraced by a large number of academic communities our approach to publishing. And we're currently the 12th largest of the scientific publishers. But I think what's more important in terms of looking at some of these performance indicators is that of the 20 largest publishers, Frontiers is the third most cited. So this, I think, is the result of the fact that we are open, and the fact that all of our articles are freely available to everyone in the world means that they're read and they're cited. If we look at the leaderboard of the various institutions from where we draw our editors, so we have actually expanded to editorial boards of over 150,000 scientists and researchers from around the world. You can see these are just some of the institutions where we have the largest number of affiliated editors. You can see we have University of California, we have the CNRS in France, the Chinese Academy of Sciences, Harvard University, NIH, et cetera. So we go to the next one. Now, okay, so yeah, so the one thing that we learned, I think, over the last 18 months is that if we pull together, we can really address major challenges like COVID with these types of open access principles. There was a CORD-19 database, which all publishers participated in. They made all of the research that was published around COVID available, freely available, so that important insights could be drawn from this work, recognizing the extent of the emergency. We'd just like to point out the fact that there are many other challenges that society faces, and from where I'm sitting, these are the sorts of challenges that also deserve the same sort of treatment. There really is no reason in this 21st century anymore for the scientific knowledge, the results of publicly funded research, to be locked up behind paywalls. By virtue of the fact that we are open, I think you can see here that we've had incredible impact. We've had between 1 and 2 billion views and downloads of our articles, and millions of citations of these articles. The mission of Frontiers is to work with scientists and to deliver the insights of scientific research in a way so that we can all live healthy lives on a healthy planet. And it is our view that the arts must be part of any holistic, multidimensional approach to understanding human well-being. At Frontiers, we can see clearly the need to break down silos between different communities, to get experts from all fields to collaborate on finding and implementing solutions. And we do more of that than just through publishing, although through publishing is clearly our main activity. It's where we put our emphasis, but we also work through a meetings program, which we call the Frontiers Forum. That's also about bringing people from different fields together and trying to see the different facets of a problem and looking for solutions together. And I'd also like to mention our Frontiers for Young Minds, which is a scientific journal for children that we launched in 2013, in which leading scientists publish their recent work in a format that 12-year-old kids can understand, the language basically calibrated to the 12-year-old. And those articles are all peer-reviewed by children, by editorial boards of children. So they learn about the scientific method, the peer review process, et cetera. So it really is a beautiful process. And again, it's I think emblematic of what we try to do at Frontiers in terms of pulling communities together around these types of projects. This special issue that we're celebrating today was published in Frontiers in Psychology, which is the most cited journal in psychology. And it really is has a very broad remit. It publishes articles in areas from clinical research to cognitive sciences, perception sciences, and consciousness, imaging studies, et cetera. And importantly, it publishes also in social psychology from all areas around the world. The Frontiers in Psychology is led by Axel Claremans, who is at the Free University in Brussels. And just a word about the project, the psychological and physiological benefits of the arts. At Frontiers, it's important for us to provide a platform and a voice to the broad scientific community, both as established and emerging. And this project began as a discussion about how the arts are being applied in clinical and healthcare contexts, in prisons and rehabilitation centers, within and without a strict therapeutic frame. So in October 2019, the project was launched, and the success has been just astounding. And it's sent a very, very strong signal about the strength of this emerging academic community. And frankly, we were very, very pleased at Frontiers, the entire team. On behalf of the entire team, I would like to let you all know how happy and gratifying it's been to play a role in the success of this project. So I'll just finish by sending a word of congratulations to the editorial team that really did an amazing job in terms of pulling this all together. So thank you very much. And I think back to Nisha.
Thank you so much, Fred and Chris. And now it is my great pleasure to introduce the co-chairs for this presentation and conversation that will follow. Professor Vicky Karku is Director of the Research Center for the Arts and Wellbeing at Edge Hill University and co-editor of this special issue and research topic, lead editor in fact. And Jen Drake is Associate Professor of Psychology at Brooklyn College and the City University of New York. Welcome, Vicky and Jen. Over to you.
I was saying it's a big pleasure to be here, but I was muted. So now that I found my voice, I'm going to say a few more things about the topic, if I may. It was lovely to hear from Fred the downloads. I hadn't recorded that, but if we go to the first, the next slide, Jen, we'll see a few. I want to say a few things about the topic and how what it has covered. We know that the art has been used as a reference for struggles, communication, and elevation of human experience. So the psychological and physiological benefits were an obvious thing for us, and this triggered the start of the project. We also found, as we were gathering papers, that there was a lot of research that was happening on the social impact of the arts in terms of families, neighborhoods, and communities. And because we have had an international editorial team, which Jen will introduce us to in a bit, we have a fabulous team, I need to say. We worked very well together, although we hadn't all met before this project started. We managed to gather a number of publications from around the world. We go to the next slide. So what we gathered had covered visual arts. It covered papers and research papers on music, on dance, theater, combined arts, and all forms of arts therapies. I know we have a number of arts therapists have joined us today. For those who are not familiar, these cover art, music, dance, drama, and poetry arts therapies. We had a number of studies that were very much around the work of the arts for children and with children. We had the large number were with adults, as you would expect. We also had a number of studies that covered work with older people. And following the social component of the publications, we had work that was trying to capture evidence around the arts in the community through intergenerational projects that were held in groups and neighborhoods. work happened in schools and museums and hospitals and care facilities and community centers. The papers covered a wide range of designs and methodologies. We have large randomized control trials, systematic reviews, experiments, neuroscientific studies, qualitative and mixed method studies. And I think the compilation is amazing. It has so many papers coming together and research work. It becomes a roadmap for current impact in terms of the benefits of the arts. It makes suggestions for future research. And I think Fred and Chris mentioned that already. It also begs for more research in the area and further funding in the area. So that's a bird's eye view of the special issue. We'll go deeper in a minute, but not before Jen introduces us to the editorial team and the presenters for today.
So I am absolutely delighted to introduce our international editorial team, and I would ask that they show their videos if they feel comfortable doing that. And so, as Vicky mentioned, these are international teams specializing in psychology of the arts as well as the creative art therapies. We represent several countries and continents, and our expertise is in music, dance, the visual arts, and theater. So we have had our fearless leader, our head editorial, the editorial team that you just met is Vicky Karku from Edge Hill University in the United Kingdom. I'm Jennifer Drake from Brooklyn College of the City University of New York in the United States. We have Felicity Ann Baker from the University of Melbourne, Australia. Joanna Chemansky Cohen from the University of Haifa in Israel. Jenny Gork from the National University of Ireland, Galway in Ireland. Corinne Yola from Alberta University in the United Kingdom. Hod Orkibi also from the University of Haifa in Israel. Emmy Panero from Yale University in the United States. And Nisha Sanjanini from New York University, also in the United States. So you'll be hearing from all of our editorial team who will either be presenting or will be providing commentary in a little bit. So again, it's been such a pleasure working with all of you and putting together this really amazing special issue. So now I'd like to introduce our presenters. So if they would also like to show their videos as well. So as Vicky mentioned, we have over 80 publications. Today we'll hear from, we're going to spotlight 5 of those publications whose presenters who published in that editorial. Their research focuses on a range of topics, so a variety of artistic disciplines and methodologies. So you're hearing about systematic reviews, randomized controlled trials, brain imaging, and experimental studies. So a really wonderful snapshot of some of the work that was published in this really terrific special issue. They are also very international in celebrating the international spirit of our editorial team. Our speakers are international, and they also represent a variety of career disciplines. We have doctoral students all the way to senior scholars. So our first presenter will be Rainbow Ho from the University of Hong Kong in Hong Kong. We will then hear from Hod Orkibi, a member of our editorial team from the University of Haifa in Israel, and his colleague Rebecca Zarate from Lesley University in the United States. Janine Bauer will speak from the University of Melbourne, Australia. Another member of our editorial team, so Emmy Panero from Yale University in the United States. And then our final speaker, Anya Zubula from the University of Highlands and Islands, Scotland. And just some general housekeeping. So we will begin with a question, overarching question that will frame the presenter's discussion. And so you'll see that question. The presenter will speak for about 5 minutes. And then a member from our editorial team will have comments. We'll do that for all 5 presentations. We'll hold questions until the end. At the very end of all the presentations, Christopher Bailey will come back to give his thoughts on our special issue and the presentations, and then we will open it up for a general discussion. So we do want to hear from you, but we just ask that you hold your questions until the end. So thank you, and I'm going to hand it back to Vicky here.
So this is our first question. Just as a way of introducing it, I would like to say that a few words. We know that the arts speak to our feelings and thoughts and our inner life. Often it speaks to struggles and pain. We know that the arts enable us to communicate these experiences to others, and that we also know that when we join our favorite dance class, in my case, or after singing in a choir, we may feel better. But as mentioned earlier by Chris, there has been a historical tension when it comes to measuring such experiences, and artists often don't enjoy the idea of measuring things. I don't always enjoy, as a researcher, the experience of measuring things. So when it comes to capturing health outcomes, this becomes a bit more challenging. And some of the studies we have done at Edge Hill University as part of the Research Center for Arts and Wellbeing, we found that we needed, next to standardized measures, to also capture data through qualitative work and users' experiences, and through arts-based means, with the art becoming data, especially when we had participants who couldn't or wouldn't speak. So these, in the frame of a randomized control trial, which is normally the design that is seen as a golden standard in terms of outcomes and establishing effectiveness, became a solution, one of the solutions we have had in managing the complexity of the artistic experience. This is some of our thoughts, my thoughts and solutions from where I'm standing, but I would like to invite our first presenter now to address this topic of effectiveness of the arts and arts therapies. We have invited a very prolific researcher to talk about this work and her work. Professor Rainbow Ho is from the University of Hong Kong. She has a number of randomized control trials under her belt. She has done work in arts and arts therapies, and she's also a fellow dance therapist. So I'm very pleased to welcome you, Rainbow, in our discussion.
Thank you very much, Vicky. So I'm glad to be here. I may start with some of my studies focusing on adults with different chronic conditions. Next slide, please. So I'm sure we all understand that the power of art is actually multidimensional. So in my presentation, I will focus more on the health outcomes. So please, next slide, please. So the first study I would like to share with you is I work with patients diagnosed with major depressive disorder with clay art therapy. So in this randomized control trial, we found that the clay art therapy can help patients with depression, have significantly reduced the depressive symptoms, and also improve the general well-being, holistic well-being. So in this study, we focus more on the psychological and social outcomes. So next slide, please. In another randomized control trial with adults with intellectual disability, we used expressive art-based intervention, which actually is an integrative method. And in this population, we understand that they may have difficulties in response to the psychological measure or questionnaires. So we use an art-based assessment as an outcome measure for this study. And we found that this art-based measure can help us understand more about the differential benefit of the intervention on male and female. And the findings actually show that intervention can enhance the male participants to express their anger emotion, and the female participants in particular to improve their behavior issues. Next slide, please. And for cancer patients who are waiting for the radiotherapy, they have different psychological issues. So we use dance movement therapy for them, but this is a very brief intervention that only lasts for a few weeks. And we found that dance movement therapy can help them buffer the deteriorations in perceived stress, pain severity, and pain interference. And we also measure the psychological outcome. We use the salivary cortisol, and we found that the intervention actually can help them to improve their cortisol slope, which represent the HPA functioning. Next slide, please. We also conduct the qualitative study. We use qualitative data to capture the changes that cannot be measured by numbers. And we found that the qualitative data align with the quantitative outcome. And in particular, their feedback was particularly relevant to dance movement therapy because they found that after the intervention, they have more appreciation for themselves and also their body. Next slide, please. And recently, we also published a study. We used the dance movement therapy for elderly with mild dementia. And we found that a dance movement therapy can help elderly with dementia have improved mood, like depression, and also the loneliness, negative mood, and also daily functioning. And in this study, we also use the physiological measure, the salivary cortisol, and we found that elderly with dementia, after the intervention, they have a better diurnal cortisol low. And also the functioning, the daily functioning, and also the physiological outcome remained after 1 whole year. And for cognitive improvement, we found that after the intervention, they have improved the total memory retrieval and also delayed recall. Maybe we need longer intervention to have a more long-lasting effect for this population. Next slide, please. The last randomized control trial I would like to share with you is we use music and movement for elderly with dementia. So in this study, we found that music intervention with some rhythmic movement can help elderly with moderate dementia have better behavioral and psychological symptoms. And this effect actually can last quite long, until the 6 weeks. So these are all the randomized control trial we have published. And now we are also working with stroke survivor using expressive therapy. And also we are going to work with mother and child using some movement-based expressive intervention. And we hope that we can capture all the physiological and psychological benefits. And then I also want to hear about my colleagues on other impacts of art. So that's all from me. Thank you. Thank you very much.
Well, thank you very much, Rainbow.
I was going to introduce you, Jenny.
Okay.
Just to say a few things about Rainbow's presentation went beyond what we have published in the Frontiers in Psychology, but it shows the potential of all the evidence that we can gather just from one part of the world. So there's much more that evidence that we can collect from all around. So Jenny, if you come in to give us your response to Rainbow's presentation, Jenny Kroak from the National University of Ireland, Galway, one of our editorial members and a fabulous colleague, music psychologist. So a music response to that, Jenny. Thank you.
So thank you so much, Rainbow, for, prolific is the right word. So I just want to say maybe a little bit about this methodology. I know we have a mixed audience here. So randomized control trials are really placed at the top of this hierarchy of evidence because they're generally seen as the best way to determine effectiveness or efficacy of various treatments and therapies. And for that reason, they're highly valued by policymakers and the people making decisions about how to allocate funds and resources. And so they're very important for us as researchers to demonstrate the impact of the arts and art therapies so that these programs can get to people who need them. But unfortunately for people like me who'd like to build this evidence-based, RCTs are very challenging to run. They're expensive. They require large teams of researchers with administrative support. Recruiting specific samples and patient groups requires major buy-in from and collaboration with multiple stakeholders. So they're very time and labor intensive, which makes Rainbow's achievements even more impressive. So congratulations on being able to run 5 randomized control trials in a good period of time with over 600 participants. So it's an incredible, incredible work. And, just some kind of things people have mentioned before me, and something I just wanted to raise to the audience is just this kind of, I suppose, maybe a tension between needing to play the game of building this evidence and demonstrating effectiveness through this kind of hierarchical and traditional model versus the potential for us to do maybe more creative work with art and maybe alongside these randomized control trials, which I noticed you had incorporated some qualitative methods alongside the quantitative methods. And, maybe in our field, we can introduce qualitative, quantitative, some more creative based methods, really to understand the context in which these effects occur. But just to emphasize the real importance of these rigorous methods that Professor Ho has obviously mastered and is leading the way here in our field to demonstrate the effectiveness of the arts and art therapies on very important clinical outcomes. So thank you very much, Professor Ho, for your very impressive presentation. And I can see a lot of comments in the chat there congratulating you on that as well. So thank you.
Thank you, Jenny. We'll now move on to our second question and second set of presentations. So in addition to studying if a particular art form has benefits, it's important to study how and why these benefits occur. So if we know that dance and music and art and theater have psychological or physiological benefits, what aspects of the art form and our engagement with the art form lead to these benefits? So it's a very important question. What mechanisms of artistic engagement are responsible for therapeutic change? So looking at the how and the why. And so I am happy to introduce our second set of presenters who conducted a scoping review of the underlying mechanisms that contributed to the therapeutic benefits of art therapy. So we have Hod Orkibi from the University of Haifa in Israel and Rebecca Zarate from Lesley University in the United States. And their work advances our understanding of what works where and with whom, and offers recommendations and a roadmap for future research. So I'm really delighted to introduce them.
Thank you, Jen. This work started in Spain, in pre-COVID Spain, in a conference that some of us have attended, and it includes 10 authors that are colleagues in this work. That is really a labor of love and trying to advance our field. Next slide, please. So out of more than 4,000 articles that we found, we narrowed down into 68 articles, and we have managed to identify 3 types of therapeutic or change factors. The first type is common factors across different psychotherapies, which means that these are factors that are really shared by different approaches of psychotherapies. The second type of therapeutic factors is the joint factors of the creative arts therapies. These are factors that are shared by the different creative arts therapies disciplines. And the third type of therapeutic factors is a specific factors of a specific creative arts therapies disciplines, for example, dramatic engagement in drama therapy or psychodrama. Next slide, please. So the analysis yielded 19 domains of arts therapies therapeutic factors, of which 3 domains are really composed only of factors that are unique, that characterize our work in the creative arts therapies, and we would like to emphasize them here. Embodiment refers to the physical and sensory experience of the client by means of engaging with the art form. And the second one is concretization, which refers to really creating something abstract, like an emotional experience, my thoughts, into a tangible form, a visible, tangible form. And the third type of therapeutic factor is symbolism and metaphor, which refers to conveying inner experiences concisely or even non-verbally in some of the modalities, which really enables bypassing language barriers. And I'm my colleague, Dr. Zarate.
Thank you, Hod. Next slide, thank you. So what our findings did was bring us closer to answering the question of which possible mechanisms of change connect creative arts therapies into interventions with health outcomes. It also strengthened our connections between our theoretical models in creative arts therapies and specific creative arts therapies factors. And prevalent orientations to psychotherapy were discovered, particularly around humanistic, psychodynamic, and integrative psychotherapies, as well as psychological processes in psychotherapy. And that shows us that the field is grounded in psychological processes and supports how the field defines and describes itself with its language. Next slide, please. And so what does this mean for our future directions? Well, we can look at pathways across and within creative arts therapy specializations. For example, we can start looking at active engagement, such as active artistic engagement between dance movement therapy and music therapy, let's say. We can also improve the effectiveness of our interventions by focusing on therapeutic factors, such as concretization, examining what making invisible to visible looks like across the specializations and within interconnected relationships between each specialization. We can look at our theory development. We can refine our theory of change that provides an underpinning rationale and structure for treatment with closer articulations of mechanisms of change. We can also contribute to closing a current gap in our literature concerning joint creative arts therapies pedagogy, and support educators to associate the change process to certain creative arts therapies mechanisms and models. And the 19 domains that we discovered provide connections to the local and global creative arts therapies community and its cross-cultural implications for teaching and learning that helps us build our collective capacity. And overall, it addresses our needs to come closer to a unified vocabulary and greater specificity in conceptualizing and operationalizing therapeutic creative arts therapies factors. And it offers a shared terminology and definitions, helps us recognize and minimize redundancy and confusion. And we can offer a transfer and translation to our wider communities for projects for policy change and build collective capacity in that way as well. And overall, you know, finally, change process research is complex. It's a complex landscape, yet it's crucial for us to cultivate in creative arts therapies. And so now I'm going to hand it over back to our colleagues and Joanna to continue the conversation and discussion on mechanisms. Thank you.
Thank you.
I'd like to first thank Hod and Rebecca for their really fabulous contribution to both theory, research, and practice. And I'd like to introduce a member of our editorial team, Joanna Chenzminski-Cohen from the University of Haifa, Israel. And she will present her own work that has been funded by the National Institute of Health to address this question: what mechanisms of artistic engagement are responsible for therapeutic change? So take it away, Joanna.
Thanks, Jen. It's great to be here. And thank you, Dr. Orkibi and Dr. Zarate, for a great introduction of your scoping review, which I believe is really important for our field at this point in time. And I can share with you an example of a mechanistic study, which I'm conducting at this time with my colleague, Dr. Karen Weiss from the University of Arizona. And we're looking at mechanisms of emotional processing and mechanisms of the cholinergic anti-inflammatory pathways. I conduct physiological research as well. And basically the way you conduct a mechanistic research is you compare an art therapy intervention and then you isolate the mechanism that you're looking at. So we're comparing an art therapy, 8-week art therapy intervention with a mandala coloring intervention that has the same components as the art therapy intervention, except for the emotional processing component. And we're right in the middle of data collection right now. And I hope to see more mechanistic studies that help us understand why what we do is working and how. So thank you very much. And please refer to the scoping review to learn more about this study. Thank you.
Thanks, Joanna. We're going to revisit a bit the main topic and the main focus of the special issue, looking at the psychological and neurophysiological outcomes of engaging with the arts. Some of the findings we have from the publications in that special issue indicate that when we use the arts, the depression, symptoms of depression get eliminated or lower. We have large RCTs in music and dance, for example, in Finland. We have a very strong study in Latvia where scores of depression have gone down. We know that anxiety gets reduced with studies in art therapy. We know that symptoms of trauma get managed through psychodrama, for example, from studies in the US and Israel. So some other studies, when it comes to working with children, we know that life functioning, and one of the studies that we published from the Research Center for Arts and Wellbeing from Edge Hill University, we found that life functioning improved. Overall well-being improved, and these improvements were sustained for at least a year after the completion of the intervention. And not only that, we saw that there were biomarkers that were supporting that work in terms of quality of sleep. So children would sleep better who participated in the interventions. And we also found when we were working with children with autism that the arts and dance were very supportive in terms of social communication. But what becomes an open question still, and we haven't had as many studies and as much research in that area, is the impact these interventions have on the brain. And I'm going to pass on in our next presentation to Janine Bauer. Janine Bauer is a PhD candidate from the University of Melbourne, and she's going to tell us what she found in the systematic review on the impact of music on the brains of children. Thank you, Janine.
Thanks, Vicky. I would also like to acknowledge that my PhD supervisors are my co-authors of this presentation, so my enormous gratitude to them. Next slide, please. In recent years, the research exploring how music is processed in the brain has really exploded, but the vast majority of this research relates to adults. And this is really problematic in paediatrics because we know that children are not just mini adults. Childhood is a period of rapid development, and children's brains are different to adults in both shape and in tissue composition. Children also obviously haven't had the neuroplastic changes that result from many, many years of rich sensory experiences that adults have had. And we also know that in clinical populations, children's brains respond very differently to brain injuries than adults do. So our intention with this systematic review was to explore brain scanning of music processing in healthy infants and children because we wanted to know what the baseline of this music processing was so we could develop more evidence-based music therapy practice specifically for children with acquired brain injuries and those presenting with disorders of consciousness. Because this is a relatively new field of study, we included all available brain scanning methodologies, even though they tell us slightly different things. So some of the methodologies like EEG report on electrical responses, and other methodologies like fMRI report blood oxygenation responses that occur secondary to the electrical responses. Next slide, please. There is good evidence that infants process the fundamental musical elements right from birth, and a response in both the advanced upper cortical areas of the brain as well as in the more primitive subcortical areas was observed in response to classical music right from birth, and there was even activation in the core emotional centres of the limbic system in the infant brain. So we know that babies were having some emotional response to music. There were well-formed electrical responses in newborns when they were exposed to pitch, beat, duration and intervals, but the responses were slower, less efficient, and came from different brain areas than an equivalent adult response. Often they also required more actual brain tissue to have an equivalent response. Nonetheless, the basics for simple melody and beat perception are certainly present from birth. Into the toddler and early childhood years, there is ongoing evidence that music process continues to occur globally throughout the brain. So again, in the upper cortical areas and in the more primitive subcortical regions, but also we started to see activation in the language and motor networks. There is also overlap in the processing of language and music in young children, and this is quite different to what we would expect to see in adults. By the adolescent years, electrical responses to music are mostly mature and stable. They are faster, more efficient, and very adult-like, but there is still some evidence of immature musical attention. Next slide, please. So what does this all mean for music therapists? Well, babies can certainly process music from birth, and children learn to understand music even without formal music education or music lessons. But the processing of music is slower and it's less efficient than what we see in adults. Babies and children also process music in different areas of their brain. For example, music and language are processed more similarly in children than it is in adults. Clinically, this means we need to be very careful of things like cognitive fatigue when working with children with brain injuries, but it also means that depending on the child's musical development and their age, we can use and manipulate specific musical elements to target specific functional outcomes in these children. It is, however, really important to note that brain processing doesn't equate to an experience of music, and babies and young children may actually experience music quite differently to how we as adults would. We don't actually know what this experience for babies is yet. Ultimately, this all means that we need more evidence. We need more evidence to understand what impact a brain injury may have on music processing, as well as the ongoing acquisition of complex musical skills. We also need more evidence with the clinical populations, like the use of music therapy with children with a brain injury. Next slide, please. One of the big things to note from the studies was that the vast majority of studies we included in the review used single musical elements like pure tones as a laboratory-based stimulus. And this is fundamentally different to the whole rich experience that we know music to be. And it's this rich experience of music that makes music such a powerful therapeutic tool for children who do have a brain injury. But I think that given that the ability to process music is present from birth, and the fact that even from birth, music processing occurs globally throughout the child's brain, some ability to meaningfully process music is likely to remain intact following a severe acquired brain injury. And this is certainly what I've seen in my almost 20 years of clinical experience. Thank you. Back over to you, Vicky.
This is an area that it's fascinating. It's still new. I'm learning every time I'm exposed to that as an area. And but we have Dr. Corinne Yola, who is more experienced than me in this area, who would like to we would like her to talk about to give us a response to this presentation. Just to say, Corinne is another member of the editorial team. with a lengthy experience of studies on neurophysiological effects of the arts. And I met Corinne many years back when she was involved in probably the largest study that took place in the UK on the neurophysiological outcomes from watching dance. So I don't think that there's a better person who can respond to this thoughtful and exciting presentation from Janine. Dr. Corinne Yola, Senior Lecturer at the School of Applied Sciences in Abertay University in Dundee. Over to you.
Thank you, Vicky, for this kind introduction, and even more thanks for Janine for her great presentation. It really offers me an opportunity to respond to 3 points that I find are hugely important, not just in music, but also other art forms, such as my area of research, which is dance. So firstly, Janine Bauer mentioned the challenge of scientific reductionism in studying neuronal responses to listening to music. This is also very highly present in dance research in the neuroscience. So dance, like music, is a hugely complex artistic phenomenon that can actually become unrecognizable in highly controlled scientific experiments. So we argued in many of our studies that dance should be studied in its full complexity, if at all possible. And it has shown that studies who are high in ecological validity, which means that the stimuli used are very close to how they would be found in real life, so quite complex, such studies allow observations that might otherwise not be possible. We conducted, for example, a study measuring audiences' brain responses when they watched a dance performance live in a theater. With this, we showed, for example, that the physical experience of the movements observed is not necessary in order to have an internal resonance evidenced. And for those of you who are neuro experts, this was a TMS study where we measured corticospinal excitability as the measurement. The second point is that not only are neuronal processes of language and music overlapping, but also those of language and dance. So this was mentioned in particular for children by Janine, but this is also present in adults. So we found, for example, that the Broca's area is significantly engaged when dancers watch dance movements that are highly complex and well structured, or as in the picture below, which is from a preliminary analysis, is when they watch dance movements compared to pedestrian movements outside. So in a way, Broca's area is normally thought of the area responsible for language understanding, but can be considered a model. So it's relevant in listening to music and watching dance, and potentially also other art forms. The third point I would like to emphasize refers to the fact that music and dance could be argued to belong together. And in fact, in many of our studies, we included music, even though we looked at the responses to dance, or other studies where we looked specifically at the effect different music has on audiences watching the same sequence of dance movements. These studies are all varied and I cannot go into detail, but they show altogether that it is important to understand dance in its full complexity and that it is a form of art that is multifaceted. So we need studies, I would argue and suggest, that do respect this, and as Janine Bauer suggested as well, because it will allow to better recognize certain outcomes, have certain observations, but also recognize that the outcomes are actually as well multifaceted. So it's not just the stimuli used, but also the outcomes. So next slide, please. And some of these multifaceted outcomes are psychosocial mechanisms, neuronal mechanisms, and biochemical mechanisms, as I discussed with a colleague in this very useful handbook of dance and well-being, for those of you who want to read some of the details. A particular example that I can give here is the issue that if you want to look for psychosocial mechanism, you use different methods than if you're looking for neuronal mechanism. And particularly in the example of the studies we did with people who suffer from Parkinson's, what is the impact of them engaging in dance? Is indeed that qualitative studies are unequivocally showing that yes, participants enjoy dancing and has a positive effect, but the quantitative or neuronal research results are quite mixed. So it is really important to use different methods and to get kind of a more complete picture of the benefits of dancing, as well as, of course, other benefits. We published a study on looking at Parkinson's, people who dance and their carers as well, to get a more complete picture of the impacts of dancing. So to conclude, for stakeholders interested in the psychological and neurophysiological effects, I pledge to fund and consider studies where dance or arts in general is studied as close as possible to real life in its full complexity. And with that, I would like to give over to the next speaker.
Thank you, Corinne, for your thoughtful review and response, and for sharing your work, very important work on dance. So now we're going to move to what are the social benefits of engaging with the arts. So much work in the arts, and as well as in our editorial, has focused on prevention and treatment of different disorders. But there is work focusing on the social impact of the arts. And I think that we can all agree that the arts can be used to bring people together. And I think that is not more prevalent now than in this pandemic, and having the arts as a way to gather and to be part of a community. And so our next speaker will be talking about the social and emotional benefits engaging in acting. And so I'm really delighted to introduce M.E. Pinheiro from Yale University. So she'll be presenting some work that she conducted at Boston College as well as at Yale. So I'm going to hand it over to M.E.
Thank you, Jen, and hello, everybody. Good morning, good afternoon, good evening, wherever you are in the world. Thank you so much for being here. And as you can see from the title of this paper, this study explores several topics around the psychological experience of acting, including dissociation and flow. And I do encourage you to read this paper in full. But for the next few minutes, I'm going to only highlight the section of this research that looked at social benefits of engaging with the arts. Next slide. So as some of you may know, a lot of acting training, at least in the United States, involves becoming the character, being in the moment, identifying with the character psychologically by feeling what the character is feeling and living truthfully under imaginary circumstances. And this is all in an effort to make the characters really come alive as if they were real for both the audience and the actor. Next slide. And since actors frequently step into the shoes of others with each new character that they play, I hypothesize that actors are more empathic people than non-actors in their everyday lives. So to explore this question, I compared two groups of participants, 44 acting students from 3 different cities in the US and 43 non-acting students. Next slide. To test empathy, I gave both groups a measure called the Interpersonal Reactivity Index. This is like a survey or a questionnaire that includes items like the sample ones on this slide, which say, I believe that there are 2 sides to every question, and I try to look at them both. When I watch a good movie, I can very easily put myself in the place of a leading character. Before criticizing somebody, I try to imagine how I would feel if I were in their place. Now, this measure has 28 items like these that describe empathy, and for each item, the participant rates themselves on a 1 to 5 scale, where 1 means does not describe me well, and 5 is describes me very well. And the great thing about the IRI is that the items describe actually 3 different types of empathy. Next slide. There is affective or emotional empathy, which means feeling what someone else is feeling. The cartoon example here shows both characters feeling physical pain because of the arrow, but a psychological example is that when you see someone cry, if you have affective or emotional empathy, you really feel their sadness. Next slide. There's also compassionate empathy, which is actually doing something to help someone else, and it is related to sympathy or pro-social behavior. So for example, if you see someone cry and you have compassionate empathy, you would go comfort that person. Next slide. And thirdly, there's cognitive empathy, which is knowing what someone else is thinking or feeling. And this is related to theory of mind and perspective taking. So like this cartoon shows, individuals might have different perspectives on the same issue, but having cognitive empathy helps us to understand the other person's point of view. Next slide. So for those of you who like charts, here is a visual representation of our findings. On the vertical axis, you can see the 1 to 5 rating scales of the IRI. The blue bar shows the average score of acting students, and the orange bar shows the average score of non-acting students. And you can see there that acting students score significantly higher than non-acting students on all 3 different types of empathy. So the blue bar is higher than the orange bar. And these findings suggest that those who study acting are more empathic people in their everyday lives than non-actors, which really provides some quantitative evidence for the social benefits of engaging with the arts. Next slide. And we also do have some anecdotal evidence for these findings from professional actors. So Claire Danes has referred to her character as that of a professional empath. And the acclaimed Meryl Streep has said that the essence of her acting is her curiosity about people. Next slide. So we know that actors are more empathic in their everyday lives than non-actors, but even more exciting is our finding that levels of empathy actually did not predict the quality of the acting. So in another part of the study, we recorded and we rated performances for both groups of participants. And actually only the acting experience predicted acting ratings. So what this tells us is that there might be benefits to acting training beyond wanting to just be a good actor. So future studies determining causation need to measure whether acting training can actually teach non-actors how to be more empathic. Next slide. And again, we do have some anecdotal evidence for this. Here is a screenshot of a local television news report about a theater that provides social skills theater classes for children. And in that segment, parents say that they did see improvement in their children's social skills after taking these classes. Of course, as a scientist, I hope to gain scientific evidence for this in future studies. Thank you again, everyone, for being here today and allowing me to share my work with you. Back to you, Jen.
Thank you, Emmy, for sharing this important work, looking at how everyday activities like acting can potentially improve our social and emotional well-being. So great work. Thank you for sharing that. And I'd like to return to our questions, or what are the social benefits of engaging with the arts? And I'm really honored to introduce one of our co-editors of our editorial who you met earlier, Nisha Sanjanani from the New York University. Her own work focuses on the psychological, physiological, and social benefits of pretending, of improvisation, of performance in varied contexts and across the lifespan. So I'll hand it over to Nisha.
Thank you so much. And hold on just one moment here. So thank you so much, Emmy. First of all, your research is just another great example of how we need to work together in order to innovate, to engage in therapeutic innovation. As you discover as a psychologist, studying the arts and studying acting specifically leads to greater empathy. We have an opportunity then to think about specific acting techniques that we might use in a therapeutic context or non-therapeutic context in schools, as you were suggesting, or in communities to build social skills and otherwise. So Dr. Pinheiro study leads her to ask if there are benefits to actor training for non-actors. And as a researcher and an educator in drama therapy, of course, I would respond with a strong yes, and that the premise of drama therapy is that the use of theater-based skills such as acting, pretending, role play, performing, and witnessing as an audience to oneself or an audience to others, for example, facilitates self-awareness, insight, and empathy. In a study that we conducted on Four Legs to Stand On, a play by Second Act, which is a US-based theater company that tours plays seeking to change perspectives on addiction, we found that performance can reduce self-stigma amongst actors who identify with struggling with addiction themselves, as well as social stigma, in that the audience is able to both empathize with the struggle that live performance can catalyze important conversations in the public sphere about topics that may be difficult to talk about. I'm going to give you another example that weaves together drama therapy, theater, and film. And in this example, which we've titled Behind Blue Sky, Behind Blue Sky brings together a critical social awareness about the impact of 9/11 on people of color and Muslims in particular in the wake of the events of September 11, 2001. In the clip that I'm going to show you, you will see a hybrid process in which drama therapist Armand Vokas and filmmaker Jesse Bennell worked with a group of 7 artists and therapists of color living in New York City to examine the psychological and physical reverberations of 9/11 that linger in the individual and collective psyche of the city and beyond 20 years later. So I'm going to show you a clip from that process, and the other reason I'm showing a clip is to also illustrate the ways in which...
Nisha,
Yes?
we're not seeing any slides.
Well, we will in a minute. Thank you so much, Sabine, for being on it. You will in just a moment. You've just got my face to work with for now. But just to say that I'm showing you this clip also as an example of the ways in which we use the arts to represent data. And in this case, the film functions as a means of conveying qualitatively the experience of the ensemble as they went through it, but it also conveys something about the outcome. So just give me a moment here and I will set this up. There we go. And Sabine, can you see this now?
Yes, sorry for interrupting, Nisha.
Not a problem at all. Thank you for your help. Here we go.
I remember morning rounds at the psychiatric hospital where I work when we heard the news that an airplane had crashed into the World Trade Center.
I remember it was the first day of my drama therapy internship at the Kid Esteem Center on Babylon, Long Island. I had to make the 8:40 train.
I remember my impression of America was of a beautiful land that emphasized freedom and equality.
I remember being so excited to start my year off right.
I remember the sudden lurch, hiss, stop of the subway on 14th Street and the announcement, "Ladies and gentlemen, there seems to be a problem at the World Trade Center."
I remember feeling scared, looking for signs for what to do. I didn't feel safe.
A plane has hit a tower in New York City?
That doesn't sound like an accident. That sounds deliberate.
The first plane had hit.
You have to remember that, this is a beautiful, bright day. So when you walked out of the north side of the building, the sun was shining, the air was clean and bright. But if you had looked out the south side, it was a whole different picture.
It was hard. It was extremely difficult. One funeral after the other funeral after the other funeral. I mean, it was endless. As a Muslim, when you pray, it is a blessing. It is sending blessing prayers to the soul of those people who pass away.
And thank you, Jen, and I'll leave it there.
Thank you, Nisha. I think we're handing it over to Vicky now.
Difficult to follow from a sensitive piece like that. I was left thinking as a somebody who hasn't been in a part of the New York experience, what would be the equivalent to me? And I was thinking, I remember how it was to be before the pandemic. So that's my translated version of that film in a way, and as a way of also shifting us to the next question, which is about the use of digital platforms and how we turned our engagement with the arts and arts therapies through these lenses. I know a number of us have been affected in many different ways. We adjusted and changed the practice in many ways, willingly or less so. And we did all sorts of things to adapt to the current situation, and the digital platforms have played a massive role in that. So I'm going to pass it on to Dr. Anya Zubala to our next presentation. Anya Zubala is, I'm very pleased to introduce her because this was one of my first PhD students. Since then she has grown massively and became a very successful researcher at the Division of Rural Health and Wellbeing at the University of Highlands and Islands in Scotland, and will introduce us to ideas about how art therapists have used digital work before the pandemic, and potentially how it can give us ideas about the future. So Anya, please take over.
Thank you very much, Vicky. So today I would like to tell you about a project investigating quite an unlikely relationship between art therapy and digital technology. It initially took a shape of an integrative review co-authored with my colleagues Nicola Kennel and Simon Hackett. We included 13 articles which largely report on art therapists' perspective, with 3 papers presenting also clients' experiences. Mixed methods were most often used, including surveys, and interestingly, none of the studies used arts-based methodologies. Next slide, please. Our project confirmed that the perception of digital technology in art therapy realm is dominated by ambivalence and tendencies to pull towards and against. And to me, this seems a natural attitude on encountering something which we do not yet fully understand. Due to COVID-19, art therapists found themselves transitioning to online practice with unprecedented speed and often against own preferences. In a survey from 15 years ago, none of the art therapists reported that they had practiced online. In contrast, in our own survey, nearly 90% of art therapists in the UK have been working online last summer. So in light of this recent transition, it is important to note that this review gathers research published before July 2020. So therefore it captures the pre-pandemic state of knowledge and experience, but does not represent art therapists' rapidly growing expertise and insights that have likely transformed in the recent months. Next slide. Numerous opportunities that digital technology presents for art therapy do not come without risks and challenges that need to be all carefully considered. For example, conducting a session online might not allow for the same assurance of privacy as in a suitable therapy room, and creating a safe emotional container in cyberspace is harder than in face-to-face therapy. Seamless sharing of artwork between the client and the therapist and observing art making process directly is also not easily achievable in an online setting. However, online delivery bridges geographical distances and makes therapy more accessible to clients living in rural and more remote areas. A degree of anonymity in an online setting might in fact increase a sense of privacy and actually be helpful in establishing deeper trust. Creating art in a home setting could also lead to increased engagement in artistic processes on a more regular basis. Next slide, please. There are polarized opinions around the therapeutic value and risks of incorporating digital arts media in therapy sessions. Probably the most prominent accusation against digital tools is their non-sensory character, lacking sensual and tactile qualities of traditional arts media, which are often considered therapeutic in themselves. It is sometimes even suggested that digital tools could impede emotional or creative expression. On the other hand, digital art making can be less intimidating and present expressive multimodal qualities not necessarily achievable with traditional physical art materials. A less free digital environment has also therapeutic benefits for clients with tactile or olfactory sensitivities. Although some of these limitations are unlikely to be resolved, it is probably safe to say that with technology generally becoming more human-oriented, we may expect an increasing relevance of digital art-making tools for art therapy. Next slide, please. A consistent theme emerges of the highly ethical and professional approach of art therapists to utilizing technology in practice. There is a common agreement that online therapy requires certain adaptations, development of suitable social protocols, and new therapeutic models. It also demands skillful facilitation in order to create a safe enough container for clients in a virtual space. Remote delivery creates subtle shifts within the unique triangular relationship between the client, the therapist, and the artwork. While the client's connection with the art is emphasized, physical separation between the client and the therapist might affect art therapy less than verbal forms of psychotherapy. There remains a lot for us to learn about the emotional and interpersonal implications of distance for development of therapeutic relationship. And on a final note, I'd like to highlight that digital media and online connectivity should not be seen as a replacement for traditional arts media or for long-established ways of working. However, they could present a new quality and added value for the profession. And there is now a rapidly growing evidence that art therapists worldwide have embraced digital technology in the last 18 months, often very successfully. But this is a different story, which I hope to be able to share with you on another occasion. Thank you so much for listening. And it was also a pleasure to share some images of the Scottish landscape with you. Thank you.
Thank you, Anya. You're taking me back what I regard to be home. You're also raising issues of travel and immediate travel, right? We came to Scotland for a bit with you, and because of digital technologies, we're going to go even faster to Australia, a place where I want to go for many years. I haven't managed because of a long travel time. So I'm going to welcome Professor Felicity Baker in this discussion now, who is going to join us from the University of Melbourne. Felicity is one of our fabulous members of the editorial team. A partner in crime in a number of projects so far, right, Felicity? I managed to keep her up a lot of nights over the last couple of years at least. And formally, I'm just going to read your full titles. Felicity is a professor in music and music therapy and the director of the International Research Partnership for the Creative Arts and Music Therapy Research Unit. So that's a formal one that goes along with a lot of very active research activity. So your responses from a music perspective to this topic will be highly appreciated.
Thank you, Vicky, but also very importantly, thank you, Anya. That was a fabulous presentation, and I really enjoyed reading your article in preparing for this presentation, not having been involved in the editorial work associated with your article. It was great. And I guess one of the reasons why I think it's wonderful, and you highlighted it just now in your presentation, was this idea that the use of digital art and online therapy can really create a safe space for people, which I think is something that we certainly don't appreciate enough, that whilst a screen creates distance, with distance there can be a sense of safety. And that's something that I really noticed when I did my first study of online therapy back in 2009 with this teenager on the slide here who has autism. And what we did is we compared the face-to-face experience with the online experience, and we videoed his songwriting that was done with a music therapist. And one of the things that was really interesting in this study was that he clearly was more safe and comfortable with the screen, creating that distance that he needed to really, he gave much more eye contact. And we actually, did a video analysis of his behaviors. And we also noticed that he was more willing to take risks in the online forum than in the face-to-face. So, for example, he was much more willing to say, no, I don't like that. I want to try it this way when he was doing his therapy online. Another project that I'm involved in at the moment, which is led by my colleague, Jeanette Tamplin, is working with Parkinson's patients in our Parkinsong choir. And this particular project, we're looking at how singing within a group context can improve the speech of people with Parkinson's disease. And of course, thanks to COVID, we've had to completely rethink the way we've delivered this project. And so we've now moved it online, and we're almost ready to go now. And there's been a lot of trials and testing of our protocol. But it seems that we will be able to do it when people turn their microphone off. And just with first explorations, again, this idea of safety really has come to the fore, where these Parkinson's patients feel much more comfortable singing when no one else can hear them, even though they still feel part of a group when they do it online. Last year, again with Jeanette Tamplin, we conducted a survey of music therapists in Australia who had moved to online delivery, and we asked them a lot of questions about what the experience was like and how easy and difficult it was to transition. And what we found in our survey was that overall, all our clinicians felt that whilst it wasn't as effective as face-to-face, it was at least better than having no therapy delivery at all. And there were some caveats to this. They realized that audio latency was an issue. There was dropout sometimes, and doing synchronous music making wasn't always possible, but they did definitely feel that it was a much more preferred option to continue therapy online than cease it entirely during COVID. They also found that family carers became more involved in their, particularly when working with children, they became more involved in the therapy process because they actually had to physically be there and assist when the clients were at the other end of the screen. And finally, my last project I just wanted to touch base on, talking about the digital use of technology in therapy, was this project I did working with people with brain injury and spinal cord injury, where we were using GarageBand as a medium to create songs, where they had to write a song about their past self, their present self, and their future self. And while we didn't really do a full evaluation of the actual GarageBand experience, we did find that they were able to explore fully through using the functionality of GarageBand. They were able to explore how they wanted their song to be expressed, how they could express their identity, and in a sense, how they could find their own voice through this exploration. So thank you, Anya. I wish I'd actually read your article before submitting our paper to the Australian Journal on our our survey of online delivery, because I'm sure I would have taken a lot from your paper. So thank you so much. It's really a great contribution to the Frontiers issue. Back to you, Vicky.
Thank you, Felicity, for sharing your fascinating work. And I'd just like to take a moment just to thank all of our speakers for sharing their really thoughtful presentations and for the important contributions that they're making both to this editorial as well as to the field more generally. And thank you also to the members of our editorial team who provided thoughtful analysis and synthesis of the work. And now at this time, before we open it up to questions from our audience, I'd like to turn it back to Christopher Bailey from the World Health Organization, who will comment on the special issue as well as the research that was just presented. So thank you, Chris.
Oh, thank you. No, and my compliments and appreciation to all the participants that we've heard from today. I think you've shown a body of work whose range and depth is quite exceptional and makes me very encouraged for the path that we're traveling down to see if we can better understand not only what works, but to start getting more concrete, specific glimpses of why it works, which I think is part of the goal. I found myself, while listening to all of the different studies, reflecting, of course, on my own experience and how much of what you're discovering quantitatively and even qualitatively does resonate with my own lived experience. And although, as I like to say, anecdote is not the singular of data, to illustrate some of the themes that we've heard today, I'm going to tell two anecdotes. The first is from a group called Elderflowers, which is a group of clinical clowns in Scotland. And the story that I heard was of a clown who was working in a center for patients living with dementia. And in this particular center, the patients had become quiescent. There was a television on all the time. There was very little social interaction. It was fairly advanced dementia in this population. And even the clinical workers had grown distant from the patients themselves. And this clown described how she came in on Valentine's Day, and she stood in front of this group who weren't even looking at the television, just not interacting with themselves or with her at all. And she came in and she began to cry. And a few of the patients looked up and took notice. And one of them said, "Why are you crying?" And she said, "It's Valentine's Day and nobody sent me a Valentine." And there was quiet. And in the back, there was this Irish man who stood up, walked over to her, and this man had not interacted with anyone for weeks. He got down on his knee, clasped his hands, and began to sing an old Irish love song. That was one example. The second example comes from my own story. A number of years ago, I was diagnosed with stage 3 cancer and was given a 50% chance of surviving the year. Spoiler alert, I lived. But what I found is when I was on full chemotherapy, instead of staying at home and removing myself from the world, I chose to write a play, and I came to New York and I produced it. And at the height of my chemotherapy, where I had blisters on my feet, I had blisters on my hands, I had blisters in my mouth, I couldn't hold things, I couldn't walk, I couldn't speak. When I was on that stage, focused on that script, interacting with the other artists, I felt absolutely no discomfort. I felt totally, as we say in both athletics and in the arts, in the zone. Now, of course, when I went home that night, I felt all the pain and there was blood in my socks, etc. But that there was that moment of respite, of feeling absolutely connected. And even though the issues surrounding my fate and my cancer did not disappear, somehow I was able to give myself that moment of respite, of healing, of joy, finding the joy again in life. Now, I don't think that theater necessarily increased my odds of surviving. It certainly reduced my cortisol levels, but other people who had engaged in the arts with a similar disease did not fare so well. They did succumb, and that easily could have been me. But I'm convinced that even if my outcome had not been positive, even if I had died of the disease, that process would have helped me give that passage meaning. And that, I'm not sure, is quantifiable. So thank you all for a wonderful series of presentations. I compliment you all. And now let's go to the Q&A.
Can I just say, Chris, thank you so much for that. We have some time for questions. I hope people have stayed in the zone and responded with their own personal experiences and anecdotes. We ask questions as part of the this special issue. We ask questions to prompt discussions. We try to answer some of these questions. This is what we have asked in the duration of the last hour and a half. How effective are the arts and arts therapies? Can we assess effectiveness? What are the mechanisms of artistic engagement? What are the outcomes? What are the social benefits? What are the digital platforms? It's an invitation for you to respond to these questions or make comments. Ask other questions if you want to. I'm going to stop and pin Anya and Christopher now. I've been here. Now I appear. I don't want to appear necessarily. So do we have questions? Nisa, are you taking questions from people?
I see Sabine has her hand raised. I don't know if others do, but I do see that she has her hand raised.
Sabine, why don't you start?
Yeah, I'm just so happy to see Rainbow and also Joanna here, because this morning, I mean, it's already 4 o'clock here. This morning we had the consensus conference on the medical guideline of psycho-oncology, and we were recommended the creative arts therapies with a level of evidence recommendation from our 1.5 years work now. And Rainbow's study really led to dance movement therapy be recognized there. And Joanna's study was among the arts therapy studies that gave us this evidence level. So I just wanted to share that. It's very exciting. And I also think, as much as it's important for us to do independent studies, it's really important for us to think about going together with these medical guideline efforts that we do in all the different countries, because it's all the same evidence that we're actually pulling from. And so I think it would be good to have some joint effort around that, which is another topic and maybe for another talk, but just as an idea and a thought. And the second thought I want to put forward today is that looking at the outcomes that we usually look at, I think we should extend our outcomes that we look at to really measuring cultural and aesthetic outcomes and make this a domain, such as just as the emotional, the cognitive, and the social domain. That there is a look, a focus on the cultural and the aesthetic domain as an outcome domain. I think that's important for our field as well. Thank you.
Thank you, Sabine. All good recommendations. We are already in the process of gathering evidence at a global and organized way. In the UK, probably for the first time, we've gathered evidence across the art therapies to feed in NICE guidelines in a slightly more organized way than we have done it before. So things are happening at the local and international level, and we need to do much more, I'm sure.
There's a question in the chat that maybe for Hode and Rebecca. This is from Susan. When identifying the specific mechanisms in dance and movement therapy, I found that embodiment and concretization were merged. Did you identify this as well?
Yeah, thanks. We can speak to that. Hod, are you there too?
Yes,
So,
go ahead, Becky.
we actually identified two separate domains within this. So embodiment was its own domain, and also concretization was its own domain. So in embodiment, we found body awareness, we found kinesthetic awareness, particularly in dance movement therapy, body awareness within art therapy, tactile qualities within embodiment, and another one that was really super interesting, the body's self-perception within embodiment. Within concretization, there's a few more, but within concretization, we actually had the reenactment that crossed over between dance movement therapy and drama therapy, an artistic product facilitating verbal reflection. So that came across all specializations, from the invisible. I keep going back to the invisible to the visible with the wonderful project around documentation of the experience of migraines that we saw in our launch events. So we had from the empirical findings, we actually had a very clear domain that was represented in embodiment and also within concretization. So, yeah, Rod, do you want to follow up?
Yes, I just want to add that one of the issues that I think that could move our field forward is actually developing specific, if Sabine spoke about arts-based outcomes, I'm now offering that we should also develop arts-based or aesthetics-based measurements to measure the process or the therapeutic factors in our studies, because these are what we call change ingredients within what we're doing in the clinical setting or even in the community setting, that really, in my view, emphasize what we bring to the table versus other kind of psychotherapies. So in a way, we need to develop probably more instruments that they can be observational as well as self-report or patient and client report and therapist report in order to capture what we are bringing into the table. There are some tools out there, but definitely we need to look into how do we measure those unique processes within the arts. This is one thing. And the second thing that I would like to emphasize, and that we use the terminology, back to the question that was asked, we use the terminologies that were used by the original authors of the papers that we included in the scoping review. And we did in the discussion mention that the categories are not, the domains are not mutually exclusive. It means that some of them do overlap. Some of this overlapping was a little bit confusing to figure out where to put it, but we used the consensus method that we involved at least 3 scholars who looked deeply into each article, and we have decided how to do it. But we really need to try to, in a way, without losing the diversity and the multitude of perception, we try to use a consistent terminology, so we are speaking a similar language, especially when we're trying to communicate it to other professionals outside of our field, because it was quite a challenge also to understand the different use of terms. So this is my end comment. Thank you.
Let me come in as a dance therapist as well. I think the two have a lot of the two concepts can easily overlap for dance therapy in particular, because we are concrete through our bodies, and embodiment and concretization therefore become one. This is a map, an original map we produce there, which then it can become much more specialized when it comes to the particular discipline and when it comes to a particular client population. Not all of that would be relevant for all. No, we have done a different set of mechanisms that are active and useful when we're thinking about depression, for example, in some of my work. So this is a starting point, a map for which I think Joanna put that very well in the earlier in response to that work of how we can take one and explore it further.
I wanted to
so we have more questions here. Yeah.
I wanted to add that I appreciate the importance of looking at the factors that relate to change in therapy. And it's also important to look at in the education world that we often talk about, at least in the United States, we talk about arts integration, and that the arts will improve math and science and social studies, but we don't really necessarily look at what factors about art. And I think that really speaks to Emmy's work, looking at like, well, there's acting, there's certain aspects of acting that lead to embodying in character that lead to empathy. And so really important of looking at that, as Hode mentioned, that factors of change, those change ingredients that are contributing to both therapy and in the education world. So I just want to thank you for your work, Rebecca and Hode. I think it's so important.
And Jen, I just want to say one more sentence, is that the conceptualization of change or therapeutic factors, you can even see that there are two terms, therapeutic factor and change factors, which is not the same as mechanisms of change. It's a different concept, and we need, if you want to learn or get more information about the difference, please be invited to look at our paper. It's Frontiers, it's online, it's open. But the important thing in my view is to really have to develop, like Becky said in our presentation, to develop a theory of change when you design the study, which means that you preconceive what is the change, why does it happen? And so the theory of change is something we also need to think about. Thank you.
Thank you very much. Lots of a lot of interest on the mechanisms, right? We need to find out what we're doing and do more of that. Articulate it. What other questions do we have from the audience? And had thinking there were a lot on the digital stuff that was quite exciting for me, and I don't know whether I would imagine it raised a lot of responses from the audience as well, or has it not? Do you find the safe space equally?
Yes. Especially
yes, who is speaking?
COVID. So COVID really accelerated our work in the digital environment. It's not an immersive environment like other colleagues are doing, but definitely implementing and translating or adapting what we are doing in therapy online is also a challenge. And this creativity comes out of the necessity of the reality. So that's also accelerated our process.
Dean, did you have your hand raised? Did you want to ask a question or comment?
Yes, I just jumping in because there are no other comments. So I was pointing out in the chat that there is research already done by Kim Dunphy about this cultural outcome domain, and it's all written down also in 2 Frontiers publications about the outcome framework, and it includes that cultural domain. So just want to encourage people to check that out and also look into the MARA app that integrates this outcome framework. And it's the digital tool that we can use in dance movement therapy for clinical assessments and also in the other creative arts therapies. It's very helpful indeed because it's multimedia and can also capture the nonverbal outputs that our patients are working with. So the concretizations, very useful indeed. And I just wanted to say that throughout these 3 days, not only today, I think I'm just coming to understand that the interconnection between the environmental problems, the decolonialization topics, and what we're doing in research is so important, and that we need to find a way to, and that this COVID situation actually gives us an opportunity to understand that, and now we need to find ways to really integrate that into what we do in research, just as a thought.
Thank you, Sabine. Thank you for that. I'm also thinking about how much the collective becomes an important device and agency here. How can we do things? What can we do together? I guess these last few days, that togetherness and the momentum that was generated through that was very exciting for me, indicating some of the work that we already doing and how we can do it better, but also pushing frontiers on the areas we haven't done yet. And I'm thinking about today, we talked about all the neuroscientific work. It's still uncharted territory, or, sort of, it has a lot of space for development, outcome studies, digital platforms, developing interventions of social benefit.
Could I make a quick intervention?
Please, Chris.
I was noticing in the introductions on the chat that Susan Magsamen from Johns Hopkins was is watching, and I just wanted to do a call out to the NeuroArts Blueprint that her group at Johns Hopkins is doing with the Aspen Institute. And one of the factors that I think comes into this is looking at the primary science of the biochemistry, the neurology of why this actually works. There was a comment made just a few minutes ago about with young people, there are some advantages being put forward that working in the arts means that, that there's some evidence that you might excel better in math or science or whatever else. That may well be the case. But I think where some of this research is looking at is specifically how the arts can interplay with the prefrontal cortex in terms of executive functions and judgment. And it gets back to this primal definition of health. The word health in English comes from an Anglo-Saxon word, which is related to our word meaning whole. It's about being a complete person and being able to balance the empathy with the intellect, and then be able to triangulate that to stepping back and having judgment as part of the evolution of our life course. And I think all of this is very exciting, but I also just wanted to do a quick call out to the NeuroArts Blueprint and the wide-ranging effort that's bringing to the field, and a greater understanding of what's happening in the brain and why during these artistic moments.
This might may be the time when I don't know whether we have Susan still here in the call, but we are running out of time, and we need to pass it on to Nisa to close it for us. Nisa?
Susan isn't with us at the moment, but we will continue these conversations. This is the first of many. And of course, this event has been part of a series of events that we have been referring to as Healing Arts New York. This event, this first roundtable, this first square table, however we want to refer to our Zoom experience together, was co-produced by NYU Arts and Health and the WHO and Frontiers. I want to thank Vicki and Jen for your wonderful moderation of our research panel and conversation today. I want to thank all of the researchers for the wonderful work and for the stories that you shared as a way of bringing that work to life. And thank you so much, Chris, again, for your comments. And for Fred, he needed to step away a moment ago to get to another meeting. I just want to put in the chat the links that were shared earlier in the conversation in case you joined later. You'll see a link there to Healing Arts New York to follow with upcoming events throughout October and our closing symposium at the Metropolitan Museum of Art on November 14th, which will be a hybrid symposium, as well as Arts and Health at NYU, and of course, this special issue of the journal where you can find many of the studies that were referenced today. So thank you all again, and this is where we'll end.